In today's health headlines, a QR code can help respond to overdoses, how this will help people with opioid use disorder, and what other services the QR code can help connect you to. We'll show you that in a second. Joining me is Dr. Robert Heimer, professor of epidemiology at Yale School of Public Health and pharmacology at Yale School of Medicine. Welcome.
Thank you for inviting me on today.
You bet. All right, first off, what is a recovery pad?
Well, before we do that, let's point out that there are probably 125,000 people in Connecticut with opioid use disorder or with addiction who would benefit from some kind of treatment. Recovery Pad is a QR code that will connect them to a system that will allow them to get medication-based treatment for opiate use disorder.
And how is this expected to assist people with this disorder?
Once they link on the QR code, they'll be directed to join a study, and that study will allow them to first communicate with a chatbot, a user-friendly, non-judgmental chatbot that ascertains their willingness to start treatment. They can also talk to a recovery coach. And the ultimate goal of this chat with the chatbot and the communications with the recovery coach is to see whether they want to start treatment with Suboxone, also known as buprenorphine, a medication-based treatment for opiate use disorder that we know is effective. It's one of the gold standard medications that's used, protects against opioid overdose, keeps people from relapsing to illicit drug use.
How did this how did this QR code come to be? It seems like an amazing idea.
Well, we have colleagues who've been working for a while in the emergency department who found that they could get people to, using a chatbot and using a recovery coach, get them to treatment, but that's in the emergency department. How do you do that in the real world? Well, almost everybody these days has a smartphone, even people who use drugs. And if they have a simple way to connect with a non-judgmental, non-stigmatizing system that will encourage them to at least talk about their problems, talk about their willingness to seek some kind of treatment for their problem, then we figure we can reach a lot more people than we can waiting for people to come to the emergency department with an opioid-related problem like a non-fatal overdose or an abscess or some other reason that brings to the emergency department.
And quickly, how do we get connected to that QR code?
Well, you scan the QR code with your phone, just like you would if you were in a restaurant looking at a menu. And you'll be directed then to an eligibility screen. At this point, we can only do this in English. Unfortunately, we can't do it in any other language. There are certain requirements. You have to be, over 18. You have to have experienced at least an overdose and survived it in the past. And then if you're eligible, we'll consent you to, since it's a research study, to join the study. And once you've done that, we will connect you first to the chatbot. You'll talk to the chatbot. If you want to go right on from there to get into treatment, we'll direct you to a provider who can prescribe Suboxone to you, or you can talk to a counselor.
All right, that's just terrific. And of course, we have this QR code on our website, WTNH.com. Dr. Robert Heimer, thank you so much.
You're welcome.